people getting this in the NHS? I mean, it's available, I understand, in the NHS.
Yeah, so we've had NICE guidelines dating back. This is 20-year anniversary of the first NICE guideline, which was calcific tendonitis of the shoulder. And, there are 4 others. So there's 5 that are NICE guidelines for. And that's plantar fasciitis, Achilles tendonitis, the calcific tendonitis of the shoulder, tennis elbow. Have I mentioned 5?
Not quite. I think you're on 3.5.
4.
4.
The other one will come to me. Tennis elbow, calcific tendonitis of the shoulder, Achilles, plantar fasciitis, and GTPS. Right. So lateral hip. There's your 5.
Okay.
And so, 20 years of that. And so if you go to the Royal National in Birmingham, the Royal National Hospital, they've got Shockwave. St Thomas's have been doing it for at least 10 years. Mm-hmm. So if you're in the right postcode, Shockwave will be available, whether it be focused or radial, which we might talk about later.
But within the physio context, it's not being looked at in an osteopathic way, if one can say that. How does that sit with you, that kind of statement, that question about how it's contextualized within the care plan? Oh,
I see. Historically, the number one thing which everyone talks about with plantar fasciitis is, with Shockwave, is plantar fasciitis. So it's quite a lot with podiatrists and treating heel pain. But I'd say that when we're doing courses and teaching, it's a fair mix of osteopaths, physios, podiatrists, and chiropractors. Across all 4. They sit in the room. There's 20 people. There'd be a fair mix of all of those. But really, what it's saying is, as I go back to the start, is if you're an osteopath and you want to treat these conditions, it's the number one evidence-based modality that you can use alongside your graded loading programs and so forth. And I think from when you graduated a little bit before me, but 20 years ago there was still this sort of you're in that bracket that does this and you're in that bracket that does that. And I think now my colleagues are physiotherapists and we share ideas all the time, and we're pretty similar. Very, very. I mean, you'd be hard pushed to see the difference between us. He does more hands-on work in private practice. I do more loaded program rehab stuff, and patients don't care. In my view, they just want answers and they want guidance and a plan. And they rarely know that I'm an osteo. They call me a physio half the time. I remember that used to be annoying to me, but not now.
Right, because they didn't know the difference, or they didn't see there was a difference.
Yeah, they sort of didn't know the difference, but I also used to probably be quite snobby about me being an osteopath, and I was very proud of what I did. And that's ebbed away, and I just realised
you're no longer proud to be an osteopath.
No, I'm not. I think I was so proud that I thought I was a little bit more significant in the world of musculoskeletal healthcare. But now that I've learned so much from other professions, I realised that was nonsense. We've all got plenty to offer, whether podiatrists, chiropractors, physios, whatever else. We've all got a skill. So it's really about the skill set that you do your postgrad in. If I'm going to be a good tendon person, doesn't matter whether you're an osteopath or physio podiatrist, go do the tendon stuff. And then, as I say, the Shockwave is a part of that.